My talk today is about liposuction and knee function. I have no disclosures, and I'm talking about the disproportionate accumulation of fat that occurs around the knees that results in significant orthopedic problems. Degenerative joint disease or arthritis of the knees is the most common orthopedic problem in lipedema patients, and it's often disabling. I'm very grateful for the previous work of Dr. Stutz on this. He's published a paper showing the abnormal accumulation of fat on the inner thighs and leading to a valgus deformity or knock knee, which puts increased pressure on the lateral compartment. My talk today focuses more on the fat accumulation in the distal thigh, which is the lower part of the thigh, and the proximal calf, right around the knee. And so this can cause a significantly restricted range of motion. This restricted range of motion plus the valgus deformity not only causes joint degeneration at the knee, but also greatly complicates a total knee replacement once the degeneration has occurred. So this restricted range of motion and improper angulation are the number one and number two causes of failed knee replacement. And so if this occurs, then there, results in chronic knee pain after the knee replacement. So the objective is really to explain how lymph-sparing liposuction can improve patient range of motion, mobility, decrease pain, reduce stress on the knee joint, both before and after, if necessary, knee surgery. So this is a case report of a lipedema patient who had advanced arthritis of the knee with markedly restricted range of motion. Her orthopedic surgeon had advised against proceeding for a knee replacement because of the high likelihood of a poor post-operative result without the correction of the abnormal fat around her knees and her legs. Preoperatively, the patient had a range of motion of just 88 degrees of flexion. So this slide shows the minimum amount of flexion required to do these activities of daily living. So as you can see here, my patient who had only 88 degrees, she would naturally have pain and stress in her knee, climbing stairs, descending stairs, sitting down, rising from a chair, tying a shoe, or squatting, just because of the restricted range of motion. So this slide shows how we measure range of motion in the knee. Basically, it's a hinged shape ruler that we fix on the femur, and then we measure the angle that the lower leg can bend or flex. Normal, as you can see, is 140 degrees, and then this slide shows in a lipedema lady, for example, my patient who had the abnormal fat accumulation depicted here in orange, and how it restricted the range of motion. So she could only get to a little under 90 degrees just because the fat in the back behind her thigh and upper calf prevented that flexion. So I'm going to focus on just the simple act of climbing stairs and the mechanics of climbing stairs. most people, when they think of a knee joint, they think of a simple hinge joint where the lower leg rotates on a fulcrum, much like or a center of rotation, much like a hinge on a door, and that's what we think of, and that's true. That's how it works. But it's actually more complicated than that. So as this rotation occurs around the center, the fulcrum, the tibia and femur slide. The center of the rotation actually slides over the top of the tibial plateau, and so if the joint is restricted from that flexion, that puts a great deal of stress in on the posterior articular surface of the femur and on the whole top of the tibia or leg bone. So this is when we talked about the angulation at the knee. We're talking about the angle that's created from the femur as we measure to the leg bone or tibia. And normally it should be pretty much straight up and down. And so this is my attempt at the straight up and down, and then this is where her the actual angulation. So she had, this is what I was talking about when I said valgus angulation or knock-kneed angulation, is that this the lower leg is rotated out. And then after surgery, you can see that there's still actually, it's hard to see this well, certainly in the back, but the angulation, while it's still not quite normal, is improved. So post-operatively, after lymph-sparing liposuction, the patient had 120 degrees of flexion, allowing for a pain-free descent of the stairs. And also, as I showed you, the valgus angulation was improved. The greatest improvement in pain came from her ability to rise from a chair and get out of a bathtub pain-free. Prior to surgery, both getting in and out of a chair and in and out of a bathtub caused significant pain. The patient was still experiencing pain with climbing stairs, and even though she had this improved range of motion. And that makes sense, because it's not as though, I mean, what we've done is we've taken some stress off the mechanics, but we have not repaired the articular surface, which still after years of wear had deteriorated. So this is just some more slides showing that the liposuction really was not just geared at the right around the knee. And I'm trying, so you can see here, we didn't do anything in the upper part, because she really this was her primary goal, and this is where we focused. It was just right around the knee, and then you can see here we also, the posterior thigh and upper calf were also treated. So in conclusion, the removal of abnormal fat from the posterior thigh and upper calf, which restricted the flexion, significantly improved the patient's knee mechanics. And also, this improvement in mechanical joint stress greatly improved her pain during activity of daily living. So at a minimum, the patient has been able to postpone her total knee replacement. And currently, she's happy with how she can get around and is not planning to do the knee replacement. But if she does have a total knee replacement, the chance of a successful knee replacement with curing her knee pain is much greater. So you know, just to sum it up, the liposuction around the fat around the legs, around the knees, improved the mechanics of the knee, decreased pain, and increased patient mobility. Thank Thank you very much.